Hi guys, welcome back to the biggest agricultural platform in Namibia, known as Ndunawe Ngombe, which means headman of cattle. My name, of course, is Mito Mutumba Simata, aka the headman of cattle. Today, on this 27th of September 2021, I want to speak on another livestock infectious disease. I know the previous video we spoke about anthrax in cattle. Today, I want to speak about bovine tuberculosis, TB in cattle TB. So, bovine tuberculosis is an infectious disease of cattle. It's caused by the bacterium Mycobacterium bovis, which can also infect and cause the disease in many other mammals, including humans, deer, in Namibia, but in the world, deer, but I don't know if we have deer in Africa. So let's say buffaloes, goats, pigs, cats, and dogs. Those are the 6 mammals that it can appear in. And in the UK, badgers. In cattle, it is mainly a respiratory disease, but clinical signs are rare. TB in humans can be caused by both the Mycobacterium bovis and the human form. How does TB spread? Evidence of bovine TB is most commonly found in the lymph glands of the throat and lungs of affected animals. This means that the bacteria can cause the disease. That causes the disease are mainly passed out of infected animals' bodies into the breath or in the discharge from the nose. So the disease can be spread through the cow breathing out or discharge from the nose, which could be mucus. Infection is mainly through inhalation or ingestion of the bacteria. Contaminated food and water can also be a source of infection. Bovine TB is transmitted from cattle to badgers or from badgers to cattle. So that's how the spread of the illness can be done between the 2 species. Cattle can spread this disease to other cattle. The way it can be spread via our breathing routes, the nose, the mouth, exhaling and breathing in. Direct via infected milk. So if a calf drinks infected milk, you can get it. Direct before birth through the placenta. Indirect via environmental contamination. Badgers can spread this disease to other badgers via close contact, including intimate contact between mother and cub. The disease can be spread between badgers and cattle. So in Europe, I believe Europe and the United States, there are badgers. So that's how it's spread mostly. So the disease between badger and cattle can be spread directly via close contact, indirectly via environmental contamination, such as the badger's spit, feces, and urine, or discharge from abscess and skin lesions of a badger. Cattle grazing areas where infected badgers have been present are exposed to a risk of the infection. Exposure may happen in farm buildings too. So routines of potential transmission from cattle to badgers are not well documented. Deers are also a potential source, but the routines of potential transmission from deer to cattle are not well established or documented. TB infection in deer tends to be enteric in deers. So how can I prevent tuberculosis in my livestock? Eradication of bovine tuberculosis is the ultimate aim of any veterinary department in any country, in this case in Namibia. But cattle farmers can play their part in reducing the spread of TB. While it is important to guarantee that a herd will remain clear of disease, it is possible to reduce the risk of disease by following the following steps. Introduction of TB into your herd by bringing in new animals. Maintain a close herd. If you must purchase cattle, purchase directly from a known source and avoid cattle that may have been frequently moved. Take particular care about the origins of the breeding cattle. Those are the 4 steps. Step number 5, ask about the test history of animals you are purchasing. So those are the 5th step. Step number 6, is isolate cattle after purchase and ask your veterinary surgeon to carry out a private tuberculosis test on an animal before you mix it with your other herd of cattle. So those are the 6 steps that you can follow. Then they continue saying, bought in beef store cattle for finishing should be kept separate from your breed stock. So building your own quarantine facility is very important if you're trying to avoid this spreading. So those are the 7 ways you can go about it. As they said, firstly, if you are bringing in new animals, quarantine them. The second one is if you are purchasing animals, make sure you purchase from a particular source and try to avoid animals that have been frequently moved. Take particular care about the history and origins of the breeding cattle. Ask about the testing past of the animals. If possible, isolate the new animals before mixing them with your herd of cattle. Calling out the vet to come and do this test. And number 6 is if you are bringing in animals that you are just going to finish off for slaughter, keep them away from your large herd. So now let's say TB has been introduced into your cattle herd. Introduction of TB into your cattle herd through contact with cattle from other herds. Maintain boundary. The first one is maintain boundaries and prevent contact with cattle from neighboring herds. Do not graze cattle in a field adjacent to cattle from a neighboring herd. That's if you're on a private farm. Do not share kraals. Do not borrow bulls. So those are the 3 steps. Introduction of TB into your herd through contact with people and equipment. This is how you can prevent introducing TB into your livestock herd with people. Avoid sharing equipment or vehicles of other farmers. Introduction of TB into your herd by slurry from other farms. Avoid grazing land for 6 weeks after spreading. Do not use slurry or manure from other herds on your land. So it can also be, as I did mention earlier, it can also be passed through the feces of livestock that have TB. So you should avoid purchasing manure from another farm and using that on your farm, probably to grow cattle feeds or to grow vegetables. And after you're done harvesting them like maize, you probably chase your cattle to go and eat those maize stalks. So that's another way you can go about it. General means to reduce the risk of the disease. Cattle should not be reliant on natural water sources and should be prevented from excess where possible. Test your herd on time and allow adequate time for the testing officer to do a test, for the testing officer to come and do the test on your cattle. So those are ways you can avoid or stop or prevent the spread of bovine tuberculosis amongst your herd of cattle. In Europe, and I believe the Americans, it's spread by badgers to cattle. And I read an article here that said bovine tuberculosis spread to South Africa and other colonies with the import of cattle from Europe in the early 1800s and was first diagnosed in a bovine in South Africa in 1880. So that's when they did the test. And then I read also on one part that bovine tuberculosis in Africa can also affect buffaloes. So a rare case of tuberculosis or bovine tuberculosis that I was reading earlier was that it was spread by a buffalo. It was a buffalo had it. A buffalo had it, and the buffalo spread that illness to the herds. It says here, and in Africa, particularly the southern part, and including ourselves where buffaloes are, it can also be found in buffaloes. In African buffalo, and has to date been diagnosed in 21 wildlife species, including several rare and endangered species. So that's how bovine tuberculosis moves along our livestock. As they said, it's dangerous. It's dangerous for humans. It's dangerous for domesticated and wildlife. So it's an illness that can affect both. And the best strategy most have, strategy in South Africa, is based on a test and slaughter. So meaning if they test the animal and the animal does test positive for bovine tuberculosis, the animal is slaughtered after that. It's slaughtered and put down. I do not know if there is medication for it, if they have any treatment for this bovine tuberculosis. Sorry, I said there isn't any vaccination. There is actually a vaccination. In South Africa, how they try to prevent bTB is by vaccination programs which show very good results both in wildlife and in cattle. But the problem, the best one they try and do is when bovine tuberculosis is discovered in a particular herd of wildlife, let's say buffaloes, they would test and slaughter. That's the process they use, testing and slaughtering. If they can't, the second one that they would do, let's say it's in domesticated cattle, in a kraal, they would place that kraal under veterinary quarantine till the virus can be eradicated. I believe this by various vaccination programs. If it can't, then their last option would be to do another test and slaughter. So the quarantine or the restriction of movement of animal can last for a couple of months, a year, or can it last indefinitely? So it depends on how severe this outbreak is and how early the vets get to the animals and start vaccinating and testing them to see if they can get them back to a clean bill of health, or if not, they start slaughtering. So they follow a test and slaughter policy. That's one way they go about it. Or they can put in quarantine and restrict movement until the outbreak is eradicated. This can take several years or last indefinitely. Sorry, not several months, but several years or last indefinitely. The same measure apply to infected buffalo population, often with no prospect of ever being eradicated. So they can do the same. They can place veterinary quarantining facility on domestic cattle, or they can do the same with buffaloes that are out in the wild. So this is how they do. They do carry out vaccinations. They do carry out vaccinations to treat wildlife and domestic animals, but which is a compulsory. So when bovine tuberculosis is detected, or you're suspecting your animals might have come into contact with animals that might have bovine tuberculosis, the best thing to do is to contact your state vet department, your DVS, state veterinary department. Call them out and call the state veterinary department and let them come out and carry out tests. Like I said, if it's been detected, it can last for several years or it can last for indefinite till they're able to eradicate. If they can't, well, then it will. Then your area you're farming in would probably remain under permanent quarantine, and that would mean that before you are even allowed to move animals, they might have to get tested and get a clean bill of health, or you might not even be allowed to move animals from that area where this tuberculosis has been found. So those are my 2 cents on bovine tuberculosis. As they said, the first time it appeared in South Africa, it was brought in by European cattle imports into Africa, and it was discovered then. So it is a very very disruptive illness in the beef industry, because when it is discovered in a particular area, it spreads quick, and if it's not controlled very fast, if it's not controlled very quickly, it can cause to the permanent closure of the beef industry in the country. So this is why it's important, and this is why it's encouraged that testing has to be done. If in an area where possible contact of wildlife and livestock is, you might have to do this. As they say here in Africa, buffaloes can also be reservoirs, can also be a reservoir of bovine tuberculosis. So with that said, ladies and gentlemen, those are my 2 cents on bTB, bovine tuberculosis, also shortened as bTB. With that said, guys, have yourself a good night. Bye for now.